The pancreas is one of the most important organs in our body, but we rarely give it the attention it deserves. Hidden behind the stomach, this organ performs vital functions like aiding digestion and regulating blood sugar levels. Without a healthy pancreas, our quality of life suffers significantly. In this video, we'll explore the early signs of pancreas problems because recognizing these signs early can make the difference between early intervention and serious complications. Join us to discover everything you need to know to protect this vital organ. First, jaundice, the visible sign you shouldn't ignore. Jaundice is perhaps one of the most obvious signs of a pancreas problem, but it's often overlooked. It manifests as a yellowish discoloration of the skin and eyes, caused by the buildup of bilirubin in the blood. Although this symptom is generally associated with liver diseases, it can also indicate pancreas problems. For example, a blockage of the bile duct, caused by a tumor in the pancreas or pancreatitis, can prevent the flow of bile, causing this color change. This symptom should not be ignored, as it could be the first sign of serious illnesses like pancreatic cancer. If you notice that your skin or eyes have taken on a yellowish tint, it is essential to consult a doctor immediately to determine the underlying cause. This sign is a clear warning that something in your body is not working as it should. Second, persistent abdominal pain, a silent alarm bell. Abdominal pain is a common symptom that can have many causes, but when it comes to the pancreas, it has some unique characteristics that we should be aware of. This pain is typically located in the upper abdomen and can radiate to the back. The most worrying thing is that it tends to worsen after meals, especially after consuming fatty foods. Many people ignore this pain, attributing it to indigestion or stress, but if it is persistent and increases in intensity, it could be a sign of pancreatitis or chronic inflammation of the pancreas. This organ, when not working properly, can trigger episodes of pain that significantly affect quality of life. If you experience this type of pain repeatedly, it is essential to consult a specialist to assess the health of your pancreas. Ignoring abdominal pain can lead to serious complications and prevent early diagnosis. Third, changes in stool, an important warning sign. Your stool can reveal a lot about your health, and in the case of the pancreas, it's crucial to pay attention to any changes. If this organ doesn't produce enough digestive enzymes, the body's ability to break down fats is compromised. This can cause pale, greasy, floating stools with a stronger odor than normal. This symptom, although unpleasant to deal with, is an important indicator of pancreas problems, such as exocrine pancreatic insufficiency or even tumors. In addition, a blockage of the bile duct can cause lighter stools, while urine becomes darker due to excess bilirubin. Ignoring these changes can delay early diagnosis. If you notice persistent changes in the color, consistency, or frequency of your stools, consult a doctor. It may be uncomfortable to talk about this topic, but it's an essential step in protecting your health and detecting problems early. Fourth, unexplained weight loss, a silent warning sign. Losing weight without dieting may seem positive to many people, but when it happens for no apparent reason, it's cause for concern. In the case of the pancreas, unexplained weight loss can be a sign that something is wrong. This organ is responsible for producing enzymes that help break down food and absorb essential nutrients. If it's not working properly, your body doesn't get the nutrients it needs, leading to gradual but worrying weight loss. In addition, more serious illnesses, such as pancreatic cancer, can contribute to this symptom. It's important to pay attention if weight loss is accompanied by other signs, such as changes in stool, abdominal pain, or fatigue. If you are losing weight without having significantly changed your diet or level of physical activity, you should consult a doctor to determine the cause. Unexplained weight loss should never be ignored. Fifth, chronic fatigue. More than just tiredness, fatigue is a common symptom, often attributed to stress, lack of sleep, or overwork, but it can also be an indicator of pancreas problems. If the pancreas doesn't regulate blood sugar levels properly, the body experiences energy crashes that lead to extreme fatigue. This feeling of exhaustion can become chronic, affecting productivity and quality of life. In more serious cases, such as diabetes, which stems from a malfunctioning pancreas, fatigue can be accompanied by excessive thirst, increased urination, and weight loss. In addition, conditions such as pancreatitis or pancreatic cancer can cause inflammation and general malaise, contributing to constant fatigue. If you feel constantly fatigued and can't find an obvious cause, consider the possibility that your pancreas may need medical attention. Chronic fatigue is not something that should be ignored. Sixth, changes in appetite, a sign of an unbalanced system. Appetite changes can be an early sign that something is wrong with your pancreas. Many people with pancreas problems complain of lack of appetite or aversion to certain foods, especially fatty foods. This is because the pancreas plays a crucial role in the digestion of fats. When it fails to do so effectively, eating these foods can cause discomfort such as bloating, abdominal pain, or nausea, which naturally leads to avoiding them. In pancreatitis, the pain after meals can be so intense that patients prefer to skip meals, contributing to weight loss and malnutrition. If you notice a significant change in your appetite and can't find a logical explanation, it's important to investigate. Your pancreas may be trying to tell you that it needs attention. Seventh, nausea and vomiting. The digestive system on alert. Nausea and vomiting are symptoms that can occur in various diseases, but they are also an early warning sign of pancreas problems. In acute pancreatitis, these symptoms are frequent due to inflammation of the organ, which affects the entire digestive function. The inflamed pancreas can interrupt the production of enzymes needed to digest food, causing stomach upset and persistent vomiting. In addition, the severe abdominal pain associated with pancreas problems can trigger episodes of persistent nausea. It is essential to pay attention if these symptoms persist for no apparent reason, such as gastroenteritis. Their recurrence, especially if combined with other signs such as changes in stool or weight loss, could indicate a serious problem. If nausea and vomiting are affecting your daily life, consult a doctor to rule out pancreas complications. Eighth, intolerance to fatty foods. A subtle but important signal. A sudden or increasing intolerance to fatty foods can be a strong indicator of a malfunctioning pancreas. The pancreas is responsible for producing enzymes essential for breaking down the fats we eat. If these enzymes are not produced in sufficient quantities, fatty foods are not digested properly, causing ailments such as bloating, feeling full, or diarrhea after meals. This symptom can be so mild that many people initially ignore it, attributing it to a large meal or stress. However, persistent intolerance to fatty foods is a sign that the pancreas is not working as it should. In more serious cases, such as in exocrine pancreatic insufficiency, this problem can significantly affect the body's ability to absorb vital nutrients. If you experience this symptom repeatedly, don't ignore it. Consult a specialist to assess your pancreas function and avoid serious complications. How to take care of your pancreas. Foods that protect it. In addition to paying attention to the signs of problems, it's essential to take proactive steps to protect the pancreas. A balanced diet can make all the difference to the health of this vital organ. Some foods stand out for their specific benefits for the pancreas. Leafy green vegetables like spinach and kale are rich in antioxidants that reduce inflammation. Red and purple fruits, such as blackberries and blueberries, contain anthocyanins, which protect cells from damage. Turmeric, a spice with anti-inflammatory properties, can be a great addition to your meals. Omega-3 rich fish, such as salmon, help fight chronic inflammation. In addition, whole grains and legumes provide fiber and important nutrients that promote digestion. Avoiding alcohol and reducing your intake of saturated fats are equally crucial measures. Remember that a balanced diet is not only good for your pancreas but also for your overall health. Listen to your body and act in time. The pancreas is a silent but vital organ that works tirelessly to keep us healthy. However, when something is wrong, your body starts sending signals that should not be ignored. From visible symptoms such as jaundice to more subtle signs such as intolerance to fatty foods or fatigue, every clue is an opportunity to act in time. Early diagnosis of pancreas problems can make the difference between effective treatment and serious complications. Not only pay attention to these signs, but also protect your pancreas and prevent future problems by adopting a healthy lifestyle and a balanced diet. If you experience any of the symptoms mentioned, do not hesitate to seek medical attention. Remember that listening to your body is the first step in taking care of your health. Thank you for watching us today, and don't forget to subscribe for more content on how to maintain your well-being.